Erin Troy, a doctor I've invited back as quick as I could get you. You're rather popular where you run your pain clinic and your wonderful practice. But I met you through Synovetin, the joint injection, because you're one of their star practitioners, having tried it on your own dog and said hallelujah. And then I think you've had quite a lot of clients that have also embraced it. Did you first learn about it because pain is something you care about so much?
It is. You're exactly right, Tracy. In the years that I've been certified as a pain practitioner, there's so many opportunities to learn about new therapies, whether they're injectables like Synovetin OA, which is certainly a mainstay in what we do, as well as some of the rehab therapies and medication supplements. It's a multimodal approach, and studying pain, you never get bored.
Is that right? Because they're constantly rethinking what they invent?
Yes, yes, and new opportunities to attack pain in a different way. What we found about studying pain is that not all pain is alike, just like for you and me.
Right.
What hurts one person may hurt another, and where's the source of the pain, and what transmitter is getting it there. And I look at pain as an 11-lane highway from the source of the pain to the brain. There are 11 different, and probably more, different
Really?
pathways. It's complicated but cool if you take the pain part out of it, but
Yes,
trying to
right.
solve it like a mystery, trying to solve what works for one pet and always being open to something new.
So, do you work in collaboration with your human patients, clients, and saying, okay, what can your pocketbook stand? What are
Mhm.
you interested in? And where do you want to start on my menu of
Yeah.
choices? Is that what you do?
You're exactly right. It's super important. If families are not engaged and on board, they're not going to be able to understand or
Yeah.
comply. And so, compliance in the veterinary world is much like it is in the human medical world. People need to understand and it needs to meet their philosophy. I've had to learn a lot about how to discuss philosophy, medical care philosophy with people.
All right, so let's talk about that for a minute. Are you talking about the holistic, you're in California, the holistic, nutsy, granola, crunchy people who say, oh, I don't want Western medicine? Or are you talking about the mainstream people, of whom I'm not, I can bridge both like you do, the mainstream people who say, sure, whatever works, doc, and I want it to work right away and be fast, as
Yeah.
opposed to nutraceuticals and supplements. See you in 6 weeks and I'll give you some feedback.
Yeah, it's interesting you ask it that way because our clients cross that spectrum from one extreme to the other. Everybody wants it fast. Doesn't matter where you fall in that spectrum
Really?
because by the time they get to me, their pet's been hurting for a while.
Oh,
And so you know how it feels when somebody you love, two-legged or four, is in pain and
mhm.
you feel like you haven't done enough. So speed and pain just don't go together,
Nope,
addressing it. Because most
nope.
of the patients I get are chronic pain patients and often have multiple areas that either have or have not been discovered are painful. A lot of people focus on joints, whether you feel more that holistic drug-free approach or you're
Right,
like drug-heavy approach.
right.
A lot of people focus solely on the joints, and there's so many other sources of pain other than just the joint.
Oh,
So
I
it's,
would love to talk about that with you because I've always had, when I've had a painful horse or a painful dog, it seemed to be a joint. And
mhm,
then it would turn out to be an ACL tear and then an ACL rupture and then surgery for the
right.
most part. Sometimes in elbows, maybe.
Mhm.
But I have a dog now, Wanda, who doesn't present with any particular painful area. I want to know what are the other 10 pathways. I think I've found now a solution. In other words, I can't use Synovetin OA. She doesn't have joint pain or
Yeah,
restriction. Once
yeah.
she gets going, she just turned 11. Once she gets going,
Congratulations.
thank you. No ACL tears, thank you. Kept her
Okay.
intact,
Love it.
unspayed people until she
Love
was
it.
just under 2 years old. And I'm convinced it's why it's the first large breed dog I've had with no ACL tear. Anyway, she has, she labors to get up from lying down. So that tells me, is it her spine? But if a regular vet, my vet, not you who have this special subspecialty of pain, pain management, if they manipulate her various body parts, she's not expressing pain. We can't see her turn around or flick her ears or anything.
Any of those subtle signs.
Right. So what do you let's say I bring my dog to you and I say I don't like to see her struggling to get up. That must be really painful because she gets up and down a lot. She has a 2-year-old little Vizsla brother. She's got to get up and down a lot. So what would you do as your first line of
Good
figuring it out?
question. So the first thing I do is I listen to the family. What is it
Okay.
they're seeing? And I might ask other questions. Are you observing them dragging a toenail on the end of a
Okay.
walk?
Okay.
Do you see them? Is there a head bob? Sometimes I'll ask for videos so I can see them in their own
Right.
area. And then I try and observe them before I even touch them. I try and observe them in my office. So I ask them to do a few things. I ask them to
Yes.
sit or down if they can, turn to the left, turn to the right, walk away from
Right.
me, walk towards me. And then I like to get my hands on them. And I'm very routine about how I palpate. And I always start at literally at the ears and I work my way down and I'm feeling for all sorts of things. When I know they've already had a workup done and the x-rays are clean, I don't even have to focus on the joints anymore. I focus on muscle, tendons, fascia. Those are
Wow.
the things I focus on. So
Fascia being the lining of the muscle, just so we all understand what fascia is.
yeah, fascia has become more well known both in the
Hmm.
human world and the veterinary world and how important it is. The fascia, I find, is my new kind of interesting thing to focus and learn more about because it connects the entire body. There are multiple
Oh,
different fascial planes that start from the ears and go to the back toe, but will crisscross over the body as it does so.
wow.
They've really done a good job mapping fascial planes in horses because they are another creature that really can have these restrictions unrelated to joint
Yes.
disease.
Yes.
And so it's detecting where that fascial pain is and trying to assess it in a patient that can't talk to you.
Yeah.
So you
It's
have to
funny.
again,
When you mention starting at the ears, it occurs to me that one of the things that I have had done, often more in horses than dogs, is the vet turns the animal's head gently but firmly all the way to one side or the other to see is there a restriction. Think about that idea that happens in the neck or maybe it's the shoulder, but that the
yeah.
animal cannot move their head comfortably, either one side or both.
So there can be a couple of reasons why that happens. And certainly the most obvious reason to most of us is there a problem in the neck itself, in the disc spinal cord area
Yes.
itself. So we try and ferret that out. There's some palpations that I like to do of each individual vertebrae to see if as I move them, if there's any discomfort there. And then I go up to the muscle and palpate the muscle. But that movement we think just confines to the neck, but it really, as you said, shoulder
Yeah.
and even the obliques in over the ribs. You can
Wow.
get an animal that really can bend. So I try and guide them first with a lure. So if you have a food
Oh,
motivated dog, I see
yeah.
how far they're willing to go with a lure. And we do it in as many directions as possible. And then certainly try some manual movement. My goal is not to make them more painful. So I like to be
Right.
mindful of that. Symmetry is so important when you invest in pain management
Yes.
because the sides should be a mirror image, right? They should be
Yes.
matched. And when
Yes.
they're not, that is significant.
Okay, so let's say we do it on Wanda, and oh wow, to the right, she's really restricted. She only goes that far. Whereas to the left, she'll go all the way around and get your piece of cheese, let's say.
Right,
And you're saying you've already done X-rays before you do all that. So
right.
let's say the X-ray didn't show arthritis, let's say. What is the next step in figuring it out?
So then for me, it's palpation, and I palpate them left and right at the same time so that my hands can compare what I feel. I'll oftentimes even close my eyes as I'm doing it so I don't get
Wow.
distracted by other things going on. And then my goal in that particular example, if it's a neck issue, is I don't give up until I get past the ribs. So I go all the way down the back, I
Wow.
go down through the front legs, I go through the armpit areas, and I come up through the intercostal muscles of the ribs before I give up and say, I haven't found it yet. So, because there
Wow.
anything in that area can restrict that movement of the neck.
So let's say you do get even as much as a yelp, but certainly a head turn in a certain area. Is that an area that you then inject with something, or do you
Oh, good
do
question.
a massage with it, chiropractic, acupuncture, all the above,
So I like, yes, ma'am. I like all the above. We have all the above at our hospital.
or
So
laser, of
yep.
course?
So laser, there's something called extracorporeal shockwave therapy, which
Whoa.
which actually has no shocks. It's the most misnamed therapy I use. It uses sound waves, not shocks.
Ooh.
It's like a deep massage and it's lovely. I've used it on myself. I love the feeling of it. It's one of those, it hurts so good as it
Yes.
releases tension.
Yes.
So for me, how I pick the therapy depends again on the client's philosophy. I've said acupuncture and chiropractic to people and watched their head blow up.
No
Um,
kidding. Even in California, which is the home of all that.
yeah, there's still people that, and one family was a young family. They're lovely people. Their reason was no science on chiropractic. And that's not an untrue statement.
Really?
We have a lot of studies on acupuncture and less so on chiropractic in animals, which I think is a disservice because I've seen some amazing results
Yes,
with
me too.
chiropractic, amazing results. So, but the whole thing in veterinary medicine is while we do our darndest to get really good, solid studies on as much as we can, we just don't have the ability or the funding to do it like they do in the human world. And
Yeah,
so a lot of what we do is anecdotal with
right.
safety barriers. We've got to have safety barriers in
Yeah.
place.
So I would just like to say, if people wonder what do you mean by funding, for the veterinary college, which is where a lot of it's usually done,
Yeah.
the funding has to come in, from what I can see, from a company that stands to make hundreds of thousands of dollars from this item should it pass muster. Now, I know that there's something called the Veterinary Oral Health Council, and it's a seal of approval. And
Yeah.
to get that seal, as I understand it, now this goes back at least a decade or 12 years. So maybe the price has gone up from $250,000 to fund a study.
Oh, yeah.
And
Yeah.
and the study doesn't even have to be all that rigorous, to be honest. I don't mean anything against that particular
No, but it's
seal,
true.
but it can be 8 dogs or 7 cats. It doesn't have to hold itself to some rigorous high scientific standard.
You're
And if the
correct.
results don't come out positive, in other words, in favor of this client that wants to make a lot of money, no harm done. You don't have to publish it because it's not
Yeah.
going to get
See,
published anyway. It's not going to be peer reviewed in most cases. So it's
right.
kind of tricky.
Yeah.
Research has been done. So that sort of brings me to the question of LVET, which
Oh,
is a
yeah.
CBD that I've been watching for years. The company, it grew from a little seed. 10 years ago, I started to reach out to them and say, I'm interested in CBD to learn more, to know more. Does it really work? You're the only ones who have funded a study and it showed it worked, but how does it work? And do you know it'll always work? And so now it's 10 years later, and I tried a whole bunch of other things on Wanda, who did not like acupuncture. She did
Interesting.
not, and she didn't like laser. She didn't like wearing the goggles. She just not afraid of the vet. She just like, I thought, I'm not going to make her miserable
No,
doing something. So I thought
no,
I'll
that's
try this Elevet because it has it for the dosing can be for large dogs. Now I'd been on a really expensive, high quality, studied nutraceutical, a joint supplement in a high dose for a 188 pound, 86 pound dog. And I don't know. It's one of those things. I guess it helps. Maybe it'd be worse if she wasn't on it, as
right.
opposed to, oh, I see a difference. So I try this Elevet, and they say, listen, you got to give it 2 weeks. It was
Mhm.
all of 3 days. The dog could get up from lying down with no pain. And I thought, I got to ask Erin Troy about this. She's got a
I
pain
love
clinic.
it. I love
And
it.
another thing I discovered, which was fascinating, which I hadn't noticed. You know how we talk about cats have to stretch their backs and why
Yes.
their nails are important, never mind the barbarous declawing.
Oh, yeah.
They must dig their claws in and pull back. It's to stretch their backs. And I hadn't paid attention to the fact that over time, Wanda was not stretching her back, which she used to do when she went downstairs. When she went on the first step, she'd stop and do a back stretch. When she got off her chaise, and she sleeps on a human chaise, never mind.
Of course she does.
When she got off of it, she would really stretch out and take her time getting off it. And I hadn't noticed
Wasn't
she
doing
wasn't
that.
doing it until she's on the Elevet CBD oil.
And it
And
came
all of a
back.
sudden, she's stretching. I thought, man, that must feel good. If it
Yeah.
hurt too much to do it before. So
Yeah.
talk about that.
Well,
You have to try everything, and you don't know what'll
you
work for
do.
one individual. But
You
talk
do.
about CBD because I have tried two other veterinary CBDs that weren't studied, but I thought, oh, CBD probably
Right.
fine. It's a serious company. It's not fly by night. It's not a company that also makes, I don't know, dog toys. It's a
Right.
company that uses
Right.
itself as a supplement company. Those had done nothing. So talk a little bit about your perspective on CBD.
My perspective is it's another tool in the toolbox. I was a big fan of it when it came out. Each state had their logistics and regulations
Well,
on
that's
what could and couldn't do. So we had to operate within those. My state has started to loosen those up so we can have frank conversations. We're not allowed to sell a product, but we can open a conversation, make a recommendation, and make a referral to products to which we have some confidence. I think with all supplements, whether it's human or veterinary, it's a little bit of the Wild West because they're not under the same regulations, obviously, that drugs are. And that's not good or bad. That's just the
right.
reality of it. I do have a lot of respect for companies that try and get that science out there because it is difficult to get studies done that are
Yeah.
reputable or have any size. But I do find that there are companies out there that are doing it, that also do third-party quality control and
Yes.
those kinds of things to give them that credibility. And Elvet has in my opinion, stand the test of time. They have done well and they're very professional. I think it's another tool that like that 11-lane highway, like on certain dogs, and certainly Wanda's a perfect example, that product hit the right receptor that was controlling her pain at that
Oh,
time.
that's what you mean about the 11 lanes. So
Yeah,
the lane that it was in was a kind of subtle one, at least in
correct.
terms of living with her or having her checked out.
Correct.
So luckily it hit it
Yeah.
because the
And
other
and
supplement
will
had all
sustain.
yeah, the other
Yeah,
supplement had four or five at least of those typically used very nice nutraceuticals. Doesn't matter which ones, but it had them all. And supposedly third party testing matters, right?
it
Because
does to me.
otherwise, yeah, otherwise you don't know that even though they intended to put X amount in each
Right.
one, did
Right.
it wind up there or not in the
Yeah.
process of making it?
Yeah. And it shows the company is dedicated and committed into having a consistent quality product all the time.
So
And so
explain
that's helpful.
about you not being able to sell it because it comes from a marijuana plant or a hemp plant.
My state is a little bit conservative about certain things. And what happened was initially when CBD became more legal for medicinal work, the veterinary community was not included in the human medical community
Oh,
when they were able to do it. So our state, our CVMA, our medical veterinary medical association that advocates for good practicing veterinarians, they do a great job. We are very lucky to have a group of these people that organized, and their job is to protect us and what we can do and advocate for us. They advocate for us in an amazing way. And so they definitely reached out to the politicians and said, hey, this is a whole medical group you missed out on. It's really helpful when you reach out to politicians that have pets so they understand a little bit better. Our lobbyists are very strategic, which is helpful. And so we've been brought into the fold so that we can, initially, we couldn't even talk about it. If a client brought it up to me, I could
oh
answer
my
questions, but
goodness.
I couldn't even bring it up. And this was probably pre-COVID. And
Wow.
so they still are uncomfortable, is my interpretation, that we are going to recommend a product that perhaps has more financial gain for us than medical gain for our patients. I I personally resent that
Wow.
because that could be the case for anything I recommend.
That's
And
right.
that's just not, and it could be for physicians as well,
Sure.
or human chiropractics or human
Yeah.
acupuncturist, all of this. So to put us in that box was a little bit, no, I got my feelings hurt for 20 seconds and then moved on. But so for me, I just work within the boundaries that I have and make sure that I've done my research, that I know what I can talk about. And now we've been able to talk about these products for quite some time, last couple years.
It's going to make it
And
pretty tough on the companies. They
it
invent these
does.
things, they work on them, they hold themselves to these rigorous standards, and then they not only cannot sell it to you as a vet to resell to people, but they can't even, they have to be very subtle about how they market to you, even.
Even they can market to us now clearly without a problem because what they're marketing to us is to refer to them. And so
Wow.
do I prefer to carry products in-house? I do because I think it's more comfortable for my clients. And I think they're more trusting, especially because I don't,
Right.
in my hospital right now, there is nothing in that hospital that I have not used on my own pets. That means preventatives, that means
Right.
supplements, that means
Right.
drugs, that means
Right.
therapies. And I won't bring a product in any of those categories that I am not comfortable using on one of my own kids. And so
Nice.
clients feel more comfortable when you make that kind of a recommendation
Yeah.
for them. So, but
And
that
they
is
also
definitely
like,
one I refer to.
and they like the convenience
Oh,
that they can leave
absolutely.
the clinic with it.
Absolutely. All of my clients are busy, and it's so much
Yeah.
easier.
Yeah.
And there's still a population, believe it or not, that doesn't need to order things online, that are like it in their
Yes.
hands when they leave.
Yes.
So,
And the older ones are like, what's that website? Do I need a password? And then it turns out they do. You
and then
know,
they get all this advertisement from
yes,
them
it's
after they've done that. And a lot of
exactly.
people don't like that. So we like to make available products that we think our clients are going to have more convenience to have it on
So what
hand for
else? So
us.
what do you have for people where pain's concerned? If you're going to do a
Oh
grab
gosh,
bag,
so much.
really?
Depending on the type of pain. So I have a musculoskeletal support. I don't know if I can say them, but I'll say them anyway.
Yeah, yeah.
A company called Standard Process.
Okay.
They're out of Wisconsin. They create whole food products. So they're not even considered a
Wow.
supplement because the ingredients in their products are grown in their farms and fields.
Whoa.
And so I love their products. They have a human line and a veterinary line, but we use that. We use a well-known glucosamine chondroitin supplement that's been around for ages. They've got some decent science behind them, reputable company, and they've improved their product. They don't sit on their laurels in their first flagship
Right.
product from 20
Right.
years ago. They continue to stay up with the science. So I've been very happy, and it's palatable. You could have an awesome product,
Oh my
but if they
God,
won't
that's
eat it,
happened. I've had
mhm,
to use cat lickable treat squirted on top of a supposedly yummy chewable, and she
yep.
has to have three of them because of her weight. So I'm like going through all these cat lickables and adding
Oh yeah.
calories. Yeah.
Oh,
So that
yeah, I
doesn't
know
really
exactly
work.
what you mean. And
Yeah.
it's inconvenient. And so when we get back to the discussion of compliance,
Yes.
it's hard to be fully compliant with something that's that much work.
And it's cost you, pick a number, under a
Oh, yeah.
hundred bucks, but not much under.
Yeah.
So are you seeing a result? Is the dog taking it willingly? The patience of waiting to see it have the result.
And that's always a conversation to have with clients about supplements because I look at supplements, we should initiate them earlier than most of us do
Right. Right.
because I look at them more like a preventative or it slows down the process as opposed to a drug, which by design tends to have a faster response because of the
Right.
nature of what it does. And so client education and setting reasonable expectations is about 50% of what I do so that clients understand I don't like disappointed clients. It breaks my heart.
Oh,
I want them to understand what the goal is and that Wanda's a perfect example. It can take trial and error to figure
it
out
does.
what's going to work and what isn't. And failure of a product isn't failure, it's education, it's
Right.
knowledge. We just
Right.
say we're going to set that one aside and we're going to move
Well,
on.
then I have an idea with just a minute left. So I've got
Yes, ma'am.
Sky, who's not quite two, and the most active dog I've ever met. You know,
Yeah.
the thing about when puppies are young, don't let them go up and down the stairs. He goes down 6 stairs at once. He flies. And we laugh and we go, careful of your elbows, Sky, because there's no stopping him. But I
Right.
could use all the joint supplements or those kind of supplements that didn't work for Wanda on him. Should I
Abs-
start him at that age?
absolutely.
I'm going to do
Absolutely.
it. He's going to get all the yummy leftovers.
Perfect. And then hopefully we delay what people say are
Yes.
inevitable, but it may
Yes.
not be. So absolutely. That's the perfect time to do it.
That's great. And then maybe at that point, then I actually buy him something of his own, not hand me downs.
There you go.
But I like the idea of starting when somebody is young. It's really
I
an
do too.
important idea. Erin Troy, you have such a cool pain clinic. I wish I
Thank you.
lived nearby. I'd come and have you do the famous Dr. Troy palpation on Wanda, and you'd say, aha, I found it. It's her left intercostal rib. We'll never know, but at least she's
Thank
comfortable
you.
for the moment. Th-
Absolutely.
Thank you for all the good you do for everybody, and I'm sure
You're
you'll be
welcome.
back another time. As soon as anything new comes down the pipe, give me a shout and we'll talk about
Absolutely.
it.
I will do it.
We want to be at the cutting edge like you are.
We sure do. Thank you so
Thank you
much,
so
Tracy. I
much.
appreciate you.
Take care. Me too,
You
you.
too. Bye bye.